Good afternoon, everybody. I'd like to first begin by thanking the Rochester Academy of Medicine today, and in particular, President Dr. Li Wei Chen and Executive Director Mark Ambrosi for hosting us for today's press conference. I also want to pause and acknowledge all of the nurses in our community on this week, our National Nurse Appreciation Week. So if you know a nurse in your family, certainly you know a nurse in the community, please thank them for their service. I also want to thank my colleagues who have joined me here today for today's event. Dr. Stephen Cook, a pediatrician at Golisano Children's Hospital, Dr. Stephen Schultz, a pediatrician at Rochester Regional Health, and Ms. Mary Sargent, a pediatric nurse at Rochester Regional Health. Also, we are expecting Dr. Angela Branch, co-director of the URMC Vaccine Treatment and Evaluation Unit, to be here in a few minutes after she joins us after a previous engagement. As you know, the U.S. Food and Drug Administration has okayed the Pfizer COVID-19 vaccine for adolescents aged 12 to 15. This age group will be able to receive the vaccine as soon as Thursday, after a CDC committee convenes tomorrow, and we anticipate will officially approve the expanded age group after tomorrow's meeting. This is very good news for our community. But I know many parents and many adolescents still have questions, and rightfully so. I hope we can begin addressing your concerns, and I hope the media today will join me in helping to alleviate the concerns that many parents and teens will have about this vaccine. This vaccine has proven to be safe and effective for ages 12 and up. Dr. Cook and Dr. Schultz are very experienced pediatricians, and they will be here to answer your questions, and they have been preparing for weeks now for this day that will finally be here on Thursday. And when she arrives, Dr. Branch will be able to discuss the scientific work that has gone on behind the scenes to ensure the safety and effectiveness of this vaccine for adolescents. And Mary Sargent can help parents and adolescents understand what really happens in our clinics, because we all know that nurses do the real work in most practices. I urge all adolescents and parents to talk with your own family healthcare provider as well. Raise your concerns, ask your questions, and please do your own research from valuable, valid sources. And as soon as you are ready, ask if your child can receive the vaccine right at your doctor's offices. I urge all of the pediatricians in our community and all of my colleagues in family medicine that they should begin to learn about how they can provide this important vaccine to our patients right in our offices. Our offices are probably the best place and the place that our patients will feel the most comfortable, and we are probably the best equipped to provide this vaccine to our community. If you are an office who is not yet providing the vaccine, the Monroe County Health Department stands ready to assist you in the process of doing so. In addition, any vaccination clinic in the community that has Pfizer vaccine will soon be able to be open to individuals now 12 and older. You can find a list of these locations at flvaccinehub.com. That's flvaccinehub.com. You can also go to the monroecounty.gov website for a list of all of the Monroe County sponsored clinics. But please do not wait. This vaccine will help keep your child safe and will in turn help keep our entire community safe. This vaccine has now been proven to be safe and effective for individuals aged 12 and up. Getting your child vaccinated will help us stop this virus from spreading throughout our community, and it will help prevent further variations, which we know will ultimately delay our emergence from this pandemic. It is easier now than ever to get this vaccine where you and your child feel most comfortable: doctor's offices, churches, schools, fire departments, and ultimately the YMCA and many more sites that we have yet to announce. So with that, I'd like to turn it over to my colleagues, Dr. Cook and Dr. Schultz, who will say a few words about this vaccine, and then we'll open up to questions.
Thank you very much, Dr. Mendoza, and I want to thank the Academy for hosting us, as well as my colleagues for joining us, and thanking the media. This has been a long effort, and as you know, it's not over yet, but we are crossing a major point now of really reaching a population that we haven't been able to yet. If you think of 15 to 17-year-olds, you're talking roughly 17 million children. You're talking a significant part of our population, and now we're going into an even younger population. And again, emphasizing Dr. Mendoza's point, this isn't just about treating children. Thousands of children have been hospitalized with the COVID pandemic because of the pandemic. Roughly 3.8 million cases in pediatric patients. So this is not something to be taken lightly. This is a disease, but more importantly, any opportunity for the disease to spread asymptomatically or with minimal symptoms is an opportunity for a variant, and it's an opportunity for worse type of situations to arise. And so that's why really vaccinate as much of the community as possible. We're very fortunate that the county health department is working with both hospital systems to try to get vaccine out into primary care settings as well as other settings, and working around state guidance as best we can to overcome those hurdles. I've been working at a state vaccination pod, which runs on a very different tempo, but we have gone through the early adopters and everyone who's ready to get it. This is still something where there's a lot of panic, there's a lot of anxiety, even before the vaccine was available and still now. So people need to be in a comfortable, safe environment, and that's what we hope we're able to bring. I know Dr. Schultz is working with the primary care team in Rochester Regional, and the University of Rochester is also working with primary care providers. One of the nice things about Rochester is it is one system of care for children. And so pediatricians and administrators across the health systems work together to make this happen. And so this is another example of how that's going to be able to be a reality for families in our community. So I'd like to introduce Dr. Schultz now, and again, thank you for joining us.
Hi, excuse me, hello. Thank you again for being here and for having this important press conference. This is fantastic news that we've been waiting for a long time. To Dr. Cook's point, we've been working together as a community for pediatrics throughout the pandemic, meeting regularly since this summer, and also more recently meeting regularly in expectation of this announcement that has come about now that Pfizer is approved down to 12 years of age. At our clinic, we've been outreaching to our 16-year-olds and above who had initially qualifying conditions, and now, more recently to everybody, and trying to get as many in as possible. I've had plenty of families calling to ask my opinion, and it's a universal yes. Get the vaccine as soon as you can, wherever you can. This is fantastic. It's going to slow the spread in our community. It's going to slow the spread across the state and country. And so getting this vaccine is extremely important. It's extremely safe, with some minimal side effects to be expected. The other part that I really wanted to speak to is on a personal level. I couldn't wait to get my own vaccine. It allowed a lot more comfort for me in the clinic. Once my wife was able to get hers, it really opened the door for us to be able to do some things that we hadn't done before, traveling and eating out and things like that. However, we still have an 8-year-old son at home, and he does not yet qualify. I cannot wait until he does, because right now we still have to be judicious and cautious about engaging in social activities. Who else is going to be there? How many people? Are the parents vaccinated? Is the restaurant offer outdoor dining? Those sorts of things. And so once we're able to advance the vaccine to more and more children, and again, this is the first important step with that, dropping it down to 12, the more we are going to be able to get life back to normal, and that's extremely important. So, as has been alluded to, we still have the mass vaccination sites that have been running, and those are available through the Finger Lakes Vaccine Hub, but all health systems and the health department are working to bring those vaccines into the primary care clinics, the OB clinics, where patients often feel the most comfortable getting guidance and input from their primary care physicians. And so I know at Rochester Regional Health, we have a plan to have those primary care sites in place by the end of this month. And so we are definitely looking forward to continuing to vaccinate as many people as we can, especially knowing that even though our cases are declining right now, there's a higher proportion of them in children because of the fact that they haven't been vaccinated, whereas so many adults have been. So, thank you.
Thank you, Dr. Schultz and Dr. Cook. Mary Sargent's here available to answer any of your questions, but at this time, we'd like to open up the floor.
I guess I'll start. I think and you all probably see it too, there is this perception sort of perhaps even parent shaming people who are on board for this vaccine in their children, because there are so many unknowns. You've probably seen comments in articles and things like that about it. How, it's almost to the point where, as a parent myself, I don't ask other parents if they're going to vaccinate their children or not, because people are apprehensive to even tell you. How do you sort of overcome the perception that we're not going to use our kids as guinea pigs?
Well, first I'll start by saying that we get nowhere by shaming one another. No matter what side of the fence you're on, whether you've gotten the vaccine, whether you're on the fence, or whether you're still very unsure, we get farther as a community by ensuring that we have safe conversation with one another. And so to the extent that people feel comfortable, I think it's a good topic to talk about. And if we can find a way to raise the conversation in a non-judgmental way, just like we do so many other difficult conversations in our lives, I think that opens the door to that comfort. But there's no question that this is going to take weeks and months. We've seen that already for adults 16 and up now. And as we move into the younger ages, I think with our kids, we're even more protective and even more cautious because they're our kids. And so I think now is the time to do everything we can to ensure that we have that safety with one another.
I think those same parents would say, well, why would I risk a vaccine that we're not 100% sure on if the messaging through this whole pandemic is kids don't get it all that bad when they do get it?
Well, I've said from the start that there is no zero risk path out of this pandemic. And surely there are going to be risks with any treatment, with any preventive maneuver that we would consider, just as there are risks with COVID. And I can tell you, and we all have taken care of kids and know of kids who have the long COVID syndrome, kids that were active, happy athletes a year and a half ago, now struggling to get out of bed and go upstairs. And while that's not common, for those parents out there who are living with this, it is extremely common. And so I don't think we can take lightly the reality that there is a choice here, and it's a difficult choice for many, but it's not as easy as saying, well, one has risk and the other has zero, because that's just not true.
Kind of dovetailing off that, there does seem to be a notion that it doesn't affect kids as much, so why should they bother? What would you say to those parents who believe that or think that?
I hear you, and I will offer that it's not that simple. We have kids who are affected. We know this is true. And we also know that kids can demonstrate perhaps a higher propensity toward transmitting it to other people. And so we have to think about the older adults and parents and others who are not yet vaccinated. We don't have herd immunity in our community yet. And so we need to do everything we can to vaccinate those to end this pandemic. We want to get out of this. We all want to have a baseball game without having to worry about what section you're in. So it's not just about our kids, it's about what we can do for the rest of society.
I have a question about specifics. Doctor, you said 3.8 million kids have been hospitalized. Is this nationwide? And do you know the number from Monroe County, the St. Louis region?
Yeah, so that information is actually from the American Academy of Pediatrics in collaboration with the Children's Hospital Association. The exact numbers hospitalized in New York State, I don't know. I'm sure there's a webpage that the governor set up a dashboard that could probably tell us. But I can tell you that we know that this is a disease that does impact kids, even from the simple standpoint of while, developmentally, we know that younger pre-adolescent kids do not seem to get as sick or get as much disease as adolescent children. So, physiologically, something that's happening when the child starts to biologically mature brings them into the same transmission level as an adult. And you have to remember, unchecked transmission can allow for more mutations. So while the virus may bind to receptors that developmentally younger kids aren't there as much, do we want it to get the opportunity to bind a different receptor and then become more transmittable in young children? I don't think we want to take that chance. So that's part of the herd immunity, and I don't believe that's disease shock. I probably got half wrong, but I'd want her to also weigh in on that, Dr.
Just real quick, our microphones are over here, so we don't, I know that they're handing you a microphone.
okay.
We don't, that's all right. I mean, no, we heard that, but and from here on, everybody.
Yeah, so start over.
I guess the one piece I would add to that is that, again, in the primary care clinic, we do have patients that have had MISC, multisystem inflammatory syndrome of children, that have been in the ICU. There have been deaths in children from COVID. Luckily, not a lot, nothing compared to adults, but I believe the latest figure I saw was 297 in the U.S. And so, how do you know? There's no way, right? You can't say you're going to be okay and have a mild symptom course and you're going to have the more serious way. So that's the advantage of the vaccine, is that everybody is protected and nobody has to worry about those serious illness, and nobody has to worry about the transmission to the same degree. So.
Dr. Branch, sorry to jump on you the minute you walked in here, but I'm wondering, I know your team has been doing a lot of studying on the vaccine, testing it in children. That's not done yet, right?
No. So right now, Pfizer's the only vaccine that's available in anyone under the age of 18, and it just got approved by the FDA for 12 to 15 years old, so we're really excited about that. They're also age de-escalating, so they're currently conducting their studies in children 12 years and younger, and they intend to go all the way down to 6 months. That's true of pretty much all the vaccine platforms. Moderna will also be doing studies like that. Johnson & Johnson, some of the newer vaccines that may come out in the next few months.
I think I'm just wondering, sort of as a parent, I have little children, or even if your 12-year-old or 13-year-old is smaller, they're getting the same dosage as a 300-pound man, and sort of side effect-wise, what are we looking at?
Yeah, so that's not necessarily true. For the 12 to 15 years old, they will be getting the same dose as adults, and probably some of the younger children. But when you get down to those really young ages, they are doing what we call dose-finding studies, where they try small doses and then they escalate up until you find a dose that is the least reactogenic, but also produces the best immune response or protection. And so that's part of the studies that have been designed in the younger age groups for all of these vaccines, which is why it's going to take us a little longer to get down to those young age groups than it did for us to get to 12 to 15. I can say within the study that in the 12 to 15 years old, they all tolerated the adult dose very well, with basically the same side effects that some of us are feeling. And they also had a very, very good immune response, which is really what you wanted. You want it to be protective with the least amount of side effects.
So just so I understand, why was 12 years old the kind of a cutoff point at this point in time?
Yeah, so I can maybe punt that to some of my pediatrician colleagues, but I will say that that's sort of the age at which things change in terms of how well you process vaccines and medications and so forth, how developmentally you're ready to sort of deal with these kinds of doses that we're talking about, how developed your immune system is. That's sort of that age, that adolescent to teen age, when they're close to being adults but not quite. And so even in the 12 to 15 years old, we don't give all 2,200 people that were in the study that big dose right away. You actually start with a very small group of kids, and you might even start with just a slightly smaller dose. And then if in that group of 8 or 10 kids it looks okay, then you go on with the trial. So even in that group, even though we consider them similar to adults but not quite, even in that group, we're very, very cautious about making sure that we pick the right dose. But I'm happy to let other people weigh in.
Got it.
Yeah.
Will these kids be able to do the walk-ins as well? Will there be enough dosage for walk-ins, or
So the magic variable is at what time we get the green light tomorrow. And I've asked my team at this point to tee it all up as though Thursday, first thing in the morning, we'll be able to have a vaccine available, Pfizer for 12 and up. But it all depends honestly on what time and at what time we can open up the system to appointments. We will accept walk-ins at the Monroe County run pods for now. I can't yet speak to the Dome or the Hawkeye, but I know that they're working on that as well. We want to do everything we can to break down barriers. Recognizing that Thursday morning may be a time when many kids are in school, we don't anticipate a large rush of people on Thursday morning, but we're going to open up an expanded cadre of appointments this weekend for anticipating the 12 to 15-year-old rush.
Is there any thought of working with schools for any sort of education on this?
Not only thoughts, but a lot of already good hard work that's already happened. We have a list of pods that we've set up at a variety of schools, going into the next week, at least 6 or 7 different districts, working with them, asking them to really help us for them to take the lead in communicating with their parents and their students, asking them what are the messages that really work well for your community. So we want to follow their lead to a large degree, and then we'll sort of come in in the background with the infrastructure for scheduling and all of that. So, but we're working very closely with the schools.
And just to clarify, 12 to 17 still requires a parent signature?
Correct.
Yeah, maybe if I could add something. Just to be clear on that, if it wasn't already known, children will not be vaccinated without parent consent, period. All right? There's lots of interesting thoughts that have come up, and having been at the Dome where we vaccinated over 200,000 people, I've had the pleasure to ask people in the observation area why you're here, how you got here, and their beliefs and concerns. And when I thought I heard every conspiracy, a new one came up. So there's the amount of unknowns really is not appropriate. There's a lot we know about this vaccine. There's a lot of safety in this vaccine. I would easily give it to my youngest daughter if she were eligible. She's not. So, and that's any of the vaccines. All three of the vaccines that are licensed in the United States, I would give to my family and to my children. So I think it's really important that we're clear on this. This is a community that is working tirelessly behind the scenes in addition to our regular jobs, trying to make this work. Dr. Mendoza, Dr. Schultz and the team at Rochester Regional reaching out to pediatricians and primary care doctors. They are chomping at the bit to do this, and it's been, because mass vaccination has been the first process, it doesn't fold into primary care the same way. And because of the availability and stuff, some of those regulations are being relieved, so we're really setting up lots of opportunities. Mass vaccination sites have been very good at doing what they did, but we're entering a different phase now, so this does need to be in different settings. I have seen people repeatedly in the past couple weeks who are just scared, not scared of the vaccine or anything, they're just scared to leave their home and want the vaccine, and it took all their courage just to get in the door. So that's not a conspiracy theory, that's just, you know, what is out there. And so we need to make this as accessible, because there's still a lot of work to do for adults in this community as well as kids. This is a first step and an important step, but there's still a lot of work to do. Thanks.
At what age can the individual get it without parent consent? What is the age?
18, and when you're an adult, yes.
Dr. Cook, you mentioned this, but not to put the rest of you on the spot who are parents, but I think that there is, you know, sometimes we see, I was surprised the other day to see the long-term care vaccination acceptance rate was under 50% for healthcare workers who are working in the midst of this. So I think people see that and say, well, if the doctors and nurses don't want to do it for their own children, why should I? Would you all give it to your kids?
Yeah, again, as I mentioned at the start, I can't wait until it's approved to younger ages so that I can give it to my son and have those opportunities to, you know, be in a more normal life than what we've been living through this pandemic. So I completely agree with that. You know, the one challenge as far as the vaccine being administered outside of the mass vaccination sites is that it's, once the vial's open, you have to give those 6 doses within a set period of time. We're hoping that they'll approve that is allowed to lengthen over time, but, you know, we'll be running things similar to a flu clinic where we have folks signed up and coming through, I know in the primary care offices, to try and limit how much we're wasting and you know, encourage how much we're giving. But yeah, we definitely want to get as many children as possible vaccinated, 12 and up. Yeah.
Quick question, Dr. Mendoza. Are we finding those that have been fully vaccinated, is the vaccine actually working?
All of the new cases in this community, with very rare exceptions, have occurred among people who are not fully vaccinated. Said another way, those who are fully vaccinated can breathe a great sigh of relief, that they are virtually guaranteed to not have any complications, hospitalizations, or deaths. If you're going to have symptoms, they'll be mild, and it's highly unlikely that you'll be able to transmit it to somebody else. And that experience is really consistent with what we're seeing across the country. So, you know, this vaccine has now been out for 6 months in real use, and we're learning a lot about it. And the numbers that we're seeing locally are paralleling what we're seeing in the studies, and that's very reassuring. You know, you don't want to enter a situation where what you're seeing is different from what's being published, but to see that what we're seeing here is what we expected is very reassuring.
We saw Dr. Mendoza at the governor's briefings. We're back at the top of his naughty list as far as transmission rates. What is your contact tracing telling you about that?
So this is one that we're digging into. When you look across the community, there is still a fair amount of disparity in terms of the vaccine rates by zip code. What I'm trying to do is overlay the positivity rates and the cases per 100,000 by zip code over the vaccination zip codes to see if there's a correlation there. You know, my sense from looking at the numbers, with roughly half of our cases being under the age of 30, I believe, is that these are younger individuals and, you know, 20 and younger congregating, and most of them are not vaccinated, and they're not taking their precautions. So in some respects, this isn't that different from the summer of 2020. We had kids gathering and not taking precautions. I think that's what we're seeing right now. And all you need is a good concentration of unvaccinated people not taking precautions to have a cluster. And, you know, our numbers are larger, but they're not in the hundreds, thankfully. But when you're looking at 0 to 10 and you see, you know, double digits, I think that's what's causing it.
And good, sir, I think a good reminder, once you get that second shot, it's not yippee skippy, I'm all set. Can you remind us again? There's a bit of a time period, right?
Indeed, it's 2 weeks before you can be yippee skippy.
Can we ask you about the masks outside too?
Yes.
I know there's a New York Times article today that's being shared widely about the 10% and under. What is your advice to folks, or how do you take that, and does that help the messaging, or hurt the messaging, I guess, you know, that you're trying to get out there?
It has certainly complicated the messaging. I think I've been feeling, and now we're starting to see, that the evidence for outdoor transmission is that, you know, it is incredibly more safe outside than it is indoors. I think as a scientific community, when we say the word hesitancy, we're often referring to the public, but I will point the finger back at us as scientists. I think we've been a little too hesitant as well to proclaim the benefits of what we know is now working. We know that masks work indoors, and we know from transmission studies, we know from our local experience in contact tracing, that outdoor transmission is exceedingly rare. And so if I could rewrite the CDC guidelines, I would take masks out completely for outdoors, except for those, you know, close conversations, those gatherings. You know, we're still a little on the fence about, you know, large gatherings like football games where everybody's, you know, yelling and so forth. But the casual outdoor, you know, setting in your backyard and parks and running on the canal path, those are very, very safe. Thank you all very much. Have a good day.
Good to see you.
Yes, likewise. There you go. I know why I don't wear this thing. It's polyester.
It's warm in here.
Hey, Dr.
Hello.
I've been waiting to meet you in real life.
Oh, well, here we are.
This is my bucket list. This is
Hey,
one thing checked off my bucket list.
We're all in this together.
Mary.